I am Dr. Shibil. Today I am going to speak about leech therapy, that is Jalogavacharana in Ayurveda. The leech therapy comes under Rektamokshana, that is bloodletting procedure in Ayurveda. So Rektamokshana contains two types. Sashastra, that means we are using with some instruments and removing the blood, that is Siraveda and Prachana. So in Shastra Karma, Sashastra means with a instrument we are removing the blood, vitiated blood, that is Siravedana and Prachana. Siravedana means we are using some needle like a 22 gauge needle and removing the blood, and also in Prachana we are taking a sharp needle and pricking, that is Prachana Karma. Next type is Anushastra, that contain Stringa, Alabu, Jaloga and Gadiyandra. Jaloga comes under our leech. Stringa means like modern hijama, we can tell. Like we are removing with a cup, vitiated blood, we are removing with a cup. That is also Jaloga also say. Also Gadiyandra. So Jaloga comes under Anushastra. Next is mode of action of Rekta Mokshana. According to Ashtanga Hridaya Sutra Sthana, 20th chapter, 37th sloka, Agre Sravati Dishtanam Kusma Bhavati Piriga. That vitiated blood flows out first, just like the yellow juice from the seed of Kusumba, that is safflower seed, before its oil flows out. So the vitiated blood flows like a Kusumba seed oil extraction. After sufficient bleeding, the flow stops by itself. It should be considered as pure, like unvitiated blood, and further flow should not be attempted. This is the mode of action of Rekta Mokshana according to Ashtanga Hridaya. That means Acharya Vagbhata said, Agre Savadi Dushtanam Kusma Bhavati Pidika. Next is Jaloga, the scientific classification. Kingdom Animaliae. Leech comes under Kingdom Animaliae, phylum Annelida and class Clitellata, order Hirudiniae, family Hiridae, and binomial name is Hiridino medicinalis. Next is the type of Jaloga. There are mainly Savisha Jaloga and Nirvisha Jaloga. Savisha Jaloga means with poisonous leeches, and Nirvisha Jaloga is non-poisonous leeches. Non-poisonous leeches we are using for a therapeutical purposes. Non-poisonous leeches are reside in freshwater pond. So we can see like types of Savisha Jaloga, that is poisonous Jalogas, leeches. That there are Krishna, Karbura, Alagarda, Indrayuda, Samudriga and Gochandana. These types are Savisha Jaloga, means they are poisonous in nature. Their main characteristic features are they are broad in middle part, and it will be slow movement. There will be hairs in their body, and it will be suck less quantity of blood. These kind of leeches are called Savisha Jaloga. There are Krishna, Karbura, Alagarda, Indrayuda, Samudriga and Gochandana. Next is Nirvisha Jaloga, that is non-poisonous leeches. They are Kapila, Pingala, Shangamugi, Mushiga, Pundarigamugi and Savariga. These leeches are non-poisonous jalogas. It lives in fresh water. The leech which is used for therapeutic purpose is known as Hirdino medicinalis, that is Nirvisha jaloga only. The symptoms of Savisha jaloga, bite as have been mentioned in Sushruta, are related to infection. It may due to the bacteria present in the leech gut symbolically. So we discussed types of jaloga, that is Savisha and Nirvisha. Nirvisha means we are using for therapeutical purposes. There are Hirdineria granulosa. Sorry, Hirdineria medicinalis. Hirdineria granulosa is another variety, but Nirvisha jaloga is Hirdineria medicinalis. Next is indications of leech therapy. Mainly in Pitta doshas we are using leech. Like Pitta dominant cases we are using more predominantly the leeches. And next is doshas which are seated in the deeper tissues. And more physiologically there is no pain at all while we are doing the leech therapy. There is no pain at all. Some patient may be like they may be fair, like it is a like a creature is like that, like slimy thing is right. So there is no pain at all, and we can do children, old age, woman, everything we can use. Like in some cases we have to exclude, that will be discussed later, like contraindication. And the disease like gulma, arsha, vidradi, kushta, vadarakta, galaroga, visha and visarpa. In this we are mainly using kushta, visha and visarpa. Okay, in Kushta we are getting good result because the visceral blood is removing through leech therapy. So the patient will get immediate relief, like 2 to 3 sitting, they will get the changes. Also in this alopecia areata, we can use this leech therapy. Also in important cases like osteoarthritis, we are using the leech therapy for pain.